Dear colleagues, dear students, we continue the lecture series from the University of Pécs, Hungary, for the 5th year medical students. The topic is psychiatry. During the previous weeks, during the previous months, we have overviewed different psychiatric illnesses as personality disorders, impulse control disorders, schizophrenia, alcohol-related problems, and anxiety disorders. Many groups of psychiatric illnesses were mentioned. And in this week, I would like to a little bit color the picture. I would like to a little bit deal with a topic which is related to psychiatry, but which is a little bit a field which has some overlap with other parts of human existence. So our today's topic is psychiatry and art. We will deal with the overlap of these two very interesting and nice fields. First, I would like to start with poets, and I wrote on this slide here the name of 4 poets who can be considered as very highly talented, and we know that psychotic illness was related to the work of these great poets. Hölderlin, the great German poet, can be mentioned, or the American Ezra Pound, who has an influence on the Beat generation, or Georg Trakl, whose face can be seen here, the Austrian expressionist poet who has a very rich imaginary poetry, and Paul Celan also, who suffered from paranoid symptoms, and we know that all of these 4 poets suffered from serious mental problems, and some effect on the poetry of these artists can be found. If we go back in history, we can see that Aristotle was the first who questioned that how can it happen that melancholia and creativity is connected in the case of many individuals, in the case of many scientists, in the case of many artists, and Aristotle highlighted this phenomenon. The same was mentioned in the 19th century in the classical book of Robert Burton, The Anatomy of Melancholy, where this overlap between melancholy and creativity was mentioned. And the Romanticism area in the 19th century was also very much interested in the field of creativity and the phenomenon of the genius and the relationship of the two. There were some French and Italian psychiatrists who made the first step towards the understanding of the relationship of psychopathology and creativity, and the first was Philippe Pinel, who worked during the Enlightenment period after the French Revolution, and he had a great influence on psychiatry, and he was the person who somehow put psychiatry back into the medical position, because in the medieval period psychiatric symptoms were seen from a religious perspective. The different mental symptoms, the different psychiatric symptoms were considered as the punishment of God or the effect of demonical possession, as we can read it in the Bible. And Pinel and the Enlightenment period French psychiatrists were the medical doctors who put back psychiatry among the different subjects of medicine, and the different symptoms, hallucinations, delusions, and other symptoms were seen as medical problems and not as a result of God punishment or demons. And Pinel had made a great work on this. And Pinel was a psychiatrist who also published a work on the artwork of a patient who suffered from delusions, and he published a work where the drawings of the patient were shown in this publication. Tardieu was the first, he was also a French psychiatrist, who introduced the understanding of patient's art to the field of forensic psychiatry, the field of forensic medicine, and he was the first who used the drawings on the paintings of mental patients during the exploration of the background of a crime. Reza published the famous book and was the first who made a classification, and he introduced the museum from the artwork of psychiatric patients, and he was also influential. And Lombroso was an Italian anthropologist, criminologist, and psychiatrist who published the famous book, which the title was Genius and Insanity, where he introduced his view that the genius and the insane, the genius and the mad is connected. Every genius should be mad, and every mad person, every insane, every psychiatric patient should show some great creativity, which is not true. We know that Lombroso was not right in this. Most of the talented individuals do not show the symptoms of psychiatric problems, and there are many psychiatric patients who do not show any talent, who do not show any creativity. But he was right that there are some overlaps between the two, but he a little bit exaggerated this association. In his book there were many chapters dealing with this topic, and I would like to bring here 4 great names. Ampère, the great physics, who threw his paper on the future of chemistry into the fire and believed that he should do this because the Satan dictated this to him. Lombroso believed that Mozart suffered from delusion of poisoning. He also mentions that Rossini suffered from manic episodes, and later he believed that he made a great sin and he needs to suffer. And also he identified the psychiatric symptoms of Robert Schumann, the great German composer who suffered from hallucinations, had periods of depression, and we know that he committed suicide at the end of his life. And what we can say here, that Lombroso was right in some cases. For example, we know that both Rossini and both Robert Schumann suffered from bipolar illness, and many medical historians strengthened this fact. But he was not right in some other cases. There are no proof that Mozart suffered from delusions. So in some cases, Lombroso's diagnosis was right, in some cases it was wrong. If we turn our attention towards the 1920s, we can see great names here. For example, the Swiss psychiatrist Morgenthaler, who published a famous book on this patient whose name was Adolf Wölfli. He was a schizophrenia patient who was hospitalized because of violent behavior and rape, and he produced a great amount of artwork, and Morgenthaler made interpretations on the work of this patient. Prinzhorn was the psychologist and psychiatrist in Heidelberg who published the book on the paintings and drawings of mental patients. And this book was highly influential from 2 perspectives, from 2 points. First, it was influenced many medical doctors, influenced many psychiatrists, who between the 2 World Wars started to collect the artwork of patients. The influential Prinzhorn book influenced psychiatrists and medical directors to develop collections on patients' artwork. This was one influence. The other influence of the Prinzhorn book, that the surrealist artists, the different avant-garde artists were very much interested, became very much interested in the artwork of psychiatric patients, and this led to some changes in art history. And for example, Dubuffet, a Swiss psychiatrist, introduced a new art movement, which he called the art brut, brutal art, or dry art movement, and later it was called outsider art. So without an academic knowledge, without education, a spontaneous artwork should be done, and this was the ideology of Dubuffet as a leading in art brut movement. And SIPE was a scientific society which was established at the second part of the 1950s, where medical psychiatrists and medical doctors and psychiatrists formed a scientific group which started to systematically research the artwork of psychiatric patients, and famous book series of the Psychiatry and Art published by Karger in the 1960s were presented as a product of the SIPE movement. Is still working. This is the Prinzhorn book. And this is another famous patient, Friedrich Sonnenstern, who was invited to the International Congress of Surrealist Artists in Paris in 1956. And this is very similar, for example, to the artwork of some surrealist artists, as Salvador Dali, for example. And Sonnenstern was treated in mental hospitals many times, and he was an invited artist in this international congress. And to get back to the story between the which I mentioned, which happened during the two world wars, as an influence of the Prinzhorn book, many collections appeared all over Europe, in Austria, in Germany, in France, a few in England, and few in Hungary. And this lecture is from the University of Pécs, and this lecture is from Hungary, so I would like to emphasize the Hungarian story. Two collections appeared, one in Budapest, in the capital of Hungary, the Zélik collection, and the other is here in Pécs, the University of Pécs, and Professor Camillo Reuter, who was the head of the department between the two world wars in Pécs, made a collection, never published, never made a publication on this, but he gathered more than 2,000 or 3,000 of works from mental patients, and this is what we call the Reuter collection. And in 1956, a young researcher, Irene Jacob, published a book both in French and in German on this collection, which was published in Hungary, but it didn't appear in Hungarian at that time. And Jacob made an interpretation and gave a summary on the work of the artists of the Reuter collection. And this is one patient who was treated in the 1950s. He was a patient with schizophrenia who was an educated artist. He was a painter. He was an academically trained painter, and this is one portrait of this patient. The other is from a serious stage of the illness, where you can see the disorganized expression of the psychotic reality, and this is very similar to the artists of surrealism. You can see a face of the patient. Instead of the two eyes, you can see two hospital beds, two eyes at the end of the hospital beds, and statues can be seen, and an electroshock machine, and a great plate which resembles the orality of the patients and the patient's interest towards oral issues, desires, eating. So this is the globe of the patient, and this disorganized way is summarized. This is another painting from the same patient where you can see a rocket and the different globes on this picture, which is somehow represents the patient loneliness in the world. Interestingly, when the patient was asked that what this patient about, this patient says that the rocket is me, and the globes are doctors, and this is a round at the ward. And the doctors every morning appeared for a round to check the patient's state, and the patient expressed in a very idiosyncratic and innovative way the feeling of loneliness during these medical rounds done by the doctors. So Jakob emphasizes very much that you should always ask the patient what the picture is about, because you can speculate, but the patient will give you the interpretation properly. Okay, and this is the 1998 new publication of this work in Hungarian, and there is also an English edition of this book. This is another short book which summarizes the page collection. The Jakob book summarized mostly the paintings and drawings of the patient, and in the middle of the 1980s, me and some other colleagues has gathered the poems and writings of the patient and published a short book on the poems of patients from the University of Pécs who suffered from psychiatric illness. The next slide is about art, illness, and diagnosis, and you can see 4 famous names who we know suffered from mental problems, who suffered from different psychiatric illnesses, as Van Gogh. You know the story of Van Gogh, that he had periods of depression. He sometimes was impulsive, seriously cut down his ear and gave it to Gauguin, and he had paranoid delusions, and he committed suicide in a violent way. And there were many publications on the diagnosis, what the problem of Van Gogh should be. And there was a famous German psychiatrist and philosopher, Karl Jaspers, who published a book on Van Gogh's illness and introduced the concept that Van Gogh suffered from schizophrenia. In contrast, French and psychiatrists from Netherlands, Dutch psychiatrists, expressed their view that Van Gogh was not schizophrenic, but he suffered from epilepsy, and this epilepsy-schizophrenia contrast existed in literature. And for a long time, this was a not decided point what could be the problem of Van Gogh's. And the beginning of the 21st century, in the American Journal of Psychiatry, a publication appeared which gathered all the medical information on Van Gogh's illness, and the authors concluded that Van Gogh suffered from a bipolar illness, he suffered from temporal epilepsy and alcohol dependence, and these three contributed to the symptoms of his psychiatric problem. Csontváry is a Hungarian painter. I don't know how much you are familiar with his name and to his paintings, but I should like to mention to the English program and to the German program students that in Pécs there is a Csontváry museum. If you have never been there, please go there, visit the museum and see the great art of Csontváry, who was a Hungarian painter. And the story is, to cut a long story short, is in 2 sentences, is that he heard a voice when he was in his 20s, and which told him that you will be the greatest painter in the world, you will be a greater painter than Raffaello was. And he started to study drawing and painting, and this led to his very nice and idiosyncratic art. And there were some debates in the Hungarian psychiatric literature what was the diagnosis of Csontváry. In one cartography, one psychiatrist said that he suffered from schizophrenia. There were others who saw his illness as more a personality disorder, a schizotypal personality disorder. This is also a question on the diagnosis of the problem. Sylvia Plath, the great American poet who was part of the confessional poetry movement in the 1950s in America, and he committed suicide, and she suffered from depression. And there were some debate in literature, pathography literature, how much her illness was borderline personality disorder, how much was it bipolar illness or depression, and this can be mentioned. And Friedrich Nietzsche, the great German philosopher of the 19th century, the author of the Eternal Recurrence, or the Will to Power and Übermensch, overman, the superman philosopher. So Nietzsche, at the end of his life, suffered from a psychotic relapse, and he died in a serious dementia state, and there were different diagnostic ideas, different diagnostic speculations, what could be the illness of Nietzsche, and I gathered these hypotheses, 6 hypotheses could be gathered, could be interpreted. In the case of Nietzsche, these were the syphilis-related general paralysis of the insane, bipolar affective disorder, brain tumor, frontotemporal dementia, Kadazil syndrome, and Melas syndrome, which is a mitochondrial illness. So these 6 hypotheses appeared during the last more than 100 years in relation to Nietzsche's illness. And in the end, I would like to turn my attention towards a switch in literature, because in the first part of the 20th century, mainly schizophrenia was related to creativity. Mainly schizophrenia as a psychopathology was seen as a background of insanity-related creativity. And in the second part of the 20th century, after the 1970s, 1980s, 1990s, more and more bipolarity, more and more mood disorders were seen as background of creativity. And a very influential book was Jamieson's book, Touched with Fire, where she published different great artists. For example, Hemingway's suicide was interpreted in the light of the great writer's mood disorder. And this turned the researchers' attention toward the research and the association of bipolarity and creativity, mood disorders and creativity. And Nancy Andreessen published a work on 30 creative writers and 30 control persons, and in the case of 80% had mood disorders, while in the controls it was only 30%. Another great publication observed 15 New York abstract expressionist painters, and among them 6 had mood disorder, 5 had drug dependence, and 3 had mania. Or a third study which reviewed nearly 300 outstanding persons' life history, 60% of them fulfilled DSM categories. And what you see here, that the most common diagnosis was mood disorder, 43%, anxiety disorder, alcoholism, and schizophrenia was much lower prevalency. So it's again a study which supported the idea that mood disorders are connected to creativity compared, for example, to schizophrenia. There were some Hungarian researchers, I don't want to go into the details, who studied some cases, for example, of the drama writer Strindberg or Gogh or Van Gogh's case, or Robert Schumann's case was mentioned, Mahler or Rossini. And this Hungarian psychiatry professor also supported the view that somehow creativity and mood disorders are related, as other authors too, in the case of Széchenyi, Gyula Juhász, poet from the 20th century, Churchill or Hemingway, where the association of mood disorder and creativity is mentioned by these authors. At the very end, I would like to mention the deep psychology of psychoanalysis of the relationship of melancholia, mood disorders, and creativity. Freud has a very short essay, a very short writing. The title is On Transience, when Freud reported on a walk, a common walk with a poet. And this poet spoke about how nice the environment was around them during the spring, but at the next moment, Freud reported that the poet started to express his anxiety about losing all this niceness which is around them. that it will be damaged, it will disappear. And Freud recognized that in the case of creative individuals, in the case of artists, there is a great anxiety around the loss, a great anxiety on object loss, a great anxiety around losing something which is important for the individual, which is important for the artist, which is important for the creative person. And later, this Freudian view was highlighted by other psychoanalysts as Melanie Klein and students of Melanie Klein, you see the names here, who expressed their view that the so-called depressive position, the depressive position in personality development, the depressive position in the personality structure is responsible somehow for creativity. That this depressive position is somehow makes a connection, shows an association with the anxiety of losing something which is important, whether it is a real loss or it's imagined loss. And creativity can be seen as a reparative way, as a reparation, as a reparative cure towards this anxiety of losing. And the anxiety of losing the important, significant object. And this is a very influential and very important discovery that that artists, that creative individuals will be the persons who has this inner fixation on the depressive position, this inner fixation to the loss, to the anxiety of losing something which is significantly important. And with this short psychoanalytic footnote, I would like to finish this lecture, and I hope that this will a little bit color up the series of the lectures on the different psychiatric illnesses.